Hi, my name is Aketa Thomas, and I'm a second-year graduate student at Liberty University. I had the opportunity to be able to intern and help with enhancement of a current health promotion program at a hospital in North Texas. The hospital's name is United Regional, and they employ roughly 2,300, a little over 2,300 people. About 78% are female and about 21 or so percent are male. They have about 2,000 people on the health insurance currently. The health promotion program started in 2009. The name of the program is called Be Healthy. And initially they started doing health screenings coupled with challenges and walking events and things of that nature. They had a committee. And what they did with the health screenings was they awarded premium discounts based on screening, and it eventually elevated to a point system regarding how one would score, and eventually evolved into the metabolic syndrome. Spouses are also included in this screening as well. And if a person does not meet the metabolic syndrome criteria, they have participation alternatives for those individuals. So the senior leadership team in 2020, I guess due to the COVID-19 pandemic, wanted to put together a way to enhance their current well-being program, seeing that stress seems to be a big factor in the healthcare system. So the goal was to develop or determine a strategy to enhance the current well-being program for the employees and the medical staff that would address physical, mental, and emotional health. They put together a team of 3 directors, and I got a chance to intern and assist those directors. The departments were human resources, chaplain services, and physician recruitment. So we put together 3 surveys. One survey was for the staff, the other survey was for leadership, and then the third survey was for the physicians. We also filled out a CDC scorecard, and we also filled out a HERO scorecard. I believe its title is HERO Health and Wellbeing Best Practices Scorecard in collaboration with Mercer. We did staff interviews and we did a SWOT analysis. So, a summary of the findings. What we found was job satisfaction was very high. However, stress was a pretty big factor, and also it seems like the staff is beginning to show signs of burnout. The medical staff for the physicians were overall pretty happy. The CDC scorecard findings regarding programming, they found that there was improvement needed in cancer education. Also, they needed more improvement in nutrition. They needed improvement in hypertension education and musculoskeletal disorders. The HERO scorecard found that the program needed improvements in organizational culture and support, program integration, and measurement and evaluation. The staff interviews went pretty well. I got a chance to interview some of the staff, and they were pretty happy with the program. What they found was that they noticed that there was a push for health promotion programming during the time of the health screenings, but not as big of a push throughout the year. So that was one of their major suggestions. Regarding the SWOT analysis, the big overall finding for the SWOT analysis was that stress was kind of currency a little bit for some of the employees. They found that stress and burnout again was kind of the major factor that seemed like the staff was going through, which is understandable, or they came off of the coattails of the COVID-19 pandemic. The plan or the strategy is to put together a leadership health promotion modeling program. They noticed that there were some improvements that needed to be made regarding communication, so they're working on ways to figure out ways to leverage technology and communication due to the multi-generational factor at the healthcare system. And they also want to create a wellness charter to help with participatory research, and also to help with buy-in or engagement from the staff. Overall, my experience with the Practicum, it was amazing, it was great. It was a lot of research, but I had a fun time doing it. The staff interviews was very, very helpful when it came to determining the culture, and the culture seemed to be one that was very helpful and a very kind, courteous culture. The programs, I thought, it's well established. I do think that they need some tweaks. So all of our recommendations, I would say, would be to begin to work on adding some best practices into their culture, which would be to try to help improve communications, at least find a modality of communications that the staff will use. Also, they need to create a leadership modeling program. I think it would be good to help with further changing or improving the culture regarding health and wellness or health promotion. Also, they need to promote their health promotion program throughout the year with various other topics like hypertension, nutrition, cancer, things like that. I think that the idea of creating a wellness committee or wellness charter is a great idea, because I think it'll create more buy-in and engagement from the staff. I would like to also take this opportunity to thank Liberty University. It's been an amazing experience learning about public health, and I'm so grateful for the opportunity to be able to do this internship, to be able to do this practicum, to be able to help, and to be able to allow my light to shine. And so I want to thank you guys very, very much. I had a wonderful experience, and you guys have a great day. United Regional has 2 fitness centers, one on their main campus and one at Barnett Road Medical Building. The main campus is open 24 hours a day, 365 days a year. They have different pieces of equipment regarding dumbbells, selectorized pieces of equipment, different pieces of aerobic equipment such as treadmills and bikes and things of that nature. They also have lockers and showers for the employees to enjoy. These are a few photos of the Barnett Road Medical Building facility. It's much smaller, more condensed. This one's open from 7 a to 7 p, but this is a smaller group of employees. Roughly a little less than 200 people enjoy this facility.